Good afternoon, everybody. Looks like we're right at 1 o'clock Mountain, 3 o'clock Eastern, and we have quite a few people still streaming in. So we're going to get started at about 2 after. Give folks a few more moments. Welcome, everybody, to Solera Health's webinar, Improving Member Well-Being with Digital Therapeutics for Mental Health and Tobacco Cessation. Before we get started, just a few logistics to get out of the way. All attendees are muted. We ask that you stay on mute throughout the presentation. If you do want to ask a question, which we encourage, use the Q&A function and we'll respond to it as those questions come in. We're going to try to leave about 10 minutes at the end of the presentation so we can do some live Q&A as well. We are recording the webinar. We'll send it around to all registrants after the webinar, likely tomorrow morning, for you to share with any colleagues who weren't able to join. And we may also be sending a brief questionnaire about your organization's interest in the topic of presentation today. So with that said, thank you for joining. I appreciate you taking the time to listen and learn about our two new exciting solutions on the Solera Connect platform today. My name is Brendan O'Connor. I am Senior Director of Enterprise Growth with Solera. I work closely with our clients and prospects to identify whether their needs can be supported with our platform and solutions. I joined Solera a couple years back as it was pivoting from a DPP company to more of a platform company comprising multiple health solutions. Really excited at the recognition of the incredible value of helping members and employees navigate this rapidly changing, growing world of CBOs and digital health and therapeutics who are eager to partner with healthcare. Prior to Solera, I spent about a decade in DC, split between federal government affairs and impact investing, targeting the social determinants of health. I'm now based in Denver, where I don't get to do any of the things that normal Coloradans do because I have a 2-year-old who's mostly a wild animal, but love it here nonetheless. And let me turn it over to my co-presenter and esteemed colleague, Dr. Byron Crow, for an introduction as well.
Thanks, Brendan. Everyone, great to meet today, and thanks so much for coming. I'm Byron Crow. I'm a physician in internal medicine here in Denver and an associate medical director at Solera, where I help design our clinical programs across our suite of physical, mental, and social health offerings. I also live in Denver and don't have a 2-year-old, and I get to enjoy, Brendan, a lot of those things that I think by the time they're 6 or 7, you'll get back at it. We'll get you back on the slopes.
We'll see. Well, thanks so much, Byron, for joining. We are going to plow right ahead. So I'm going to stop the video here because most folks will be looking at the screen anyways. And before we jumped into kind of the core of today's presentation and topic, we wanted to spend just a few moments for the folks who aren't as familiar with Solera to play a little bit of catch up. Walk you through kind of who we are, our core capability and value to payers, employers, and members. At the highest level, as you can see, we've been around for a few years, founded in 2015, fortunate to be backed by a number of strategic healthcare investors, a lot of blues plans. And we've served over 50 clients over the years, primarily serving ASOs and employers, and have seen upwards of a couple 100,000 enrollees in our various programs, a great NPS of 65, and importantly, increased health plan and employer satisfaction for enrollees in our solutions. We solve 4 critical payer and employer needs. First, we drive improved engagement and health outcomes through our proprietary matching solution. We're all used to seeing great sounding programs launch and then land with a thud. And this is often due to poorly planned and executed engagement and a lack of personalization in the benefits and programs. But by offering choices to members and then helping them navigate those options to their best fit program, we can increase the likelihood of enrollments, engagement, and outcomes. Next, we offer an alternative to the point solution innovation conundrum of having to pick one solution per category, given typical procurement biases and processes and bandwidth constraints. Instead, we thoughtfully curate multiple point solutions in traditional and emerging solution categories, allowing you to streamline procurement, but also rapidly test and compare point solutions. So instead of spending 3 years to vet, procure, implement, and test before knowing whether to scale or decide whether to pivot, we can condense that time frame down to months while reducing your risk of picking the wrong one. Our streamlined procurement means that we take on the role of outsourced innovation partners. For payers, we can help you be more responsive and agile to meet the needs of your strategic groups and accounts looking to you for innovation. And for employers, we can ensure you're offering best-in-class point solutions to your employees, responding quickly to their changing needs and preferences. And lastly, by hosting multiple solution categories and dozens of point solutions under one member experience, we simplify access to and engagement with the programs you want to see utilized to drive better outcomes. So at our core, we do 3 things. First, we serve as the outsourced point solution curation and innovation shop for our clients. Now, that doesn't mean that you don't have a seat at the table. Rather, we're working together to strategize for the solutions your population needs to be healthy and happy. And then taking all of that administrative burden, time, and cost off of your shoulders to vet, contract, implement, manage, and pay this growing world of point solutions. We think it's simply unsustainable to expect most buyers to be able to keep on top of this rapid pace of innovation, know who does what well for which populations, and to be agile enough at the same time to change course when certain point solutions aren't cutting it, due to the change costs that go along with replacing point solutions. So we offer a streamlined solution that allows you to rapidly spin up new solution categories, offering multiple point solutions per category to make sure that we're covering the needs of your broadest population possible. And then we stay on top of managing them. Where we've shown a healthy competitive marketplace of point solutions raises the outcomes of all participating providers. Second, we strive to support the person rather than the condition. And to do so, we ingest data from you and hear directly from the individual to create persona archetypes that allow us to effectively match people to their best fit solutions based upon preferences, goals, and needs. This is important because it personalizes the solutions. And we know that this drives better engagement and outcomes. But it also allows us to get better over time. As we learn more and more about personas across our entire book of business, the matching algorithm gets smarter to better connect people to the solution most likely to work for them. We help take some of the guesswork out of for people to choose solutions that on the surface may look similar, not too much of a difference between choosing one versus the other, but in reality have really important nuances and differentiators. And third, we do the grunt work of managing point solution performance and administration. With one large blue plan client of ours, they estimate we save them anywhere between $800,000 and $1.2 million per managed vendor by working with Solera as their one contract and one point of contact for the marketing, implementation, contracting, reporting, compliance, and payment functions of multiple point solutions. And as part of this, we help drive pricing efficiencies by paying our point solutions based upon validated enrollment, engagement, and outcomes milestones, so you have confidence that you're only paying for what works. So I know this sounds like a lot, but to make this real, payers and employers are generally partnering with us around 3 use cases, all of which leverage our scalable core capabilities of eligibility verification, making sure folks are eligible for the plan and the solution, point solution curation and management, cross-condition management and care pathways, so not just solving for the condition, but for the whole person, persona modeling and point solution matching, engagement and outcomes verification, digital engagement and outcomes-based billing and claims adjudication. So first, we can be your branded digital front door for access to multiple Solera and non-Solera point solutions. We power Blue Shield of California's Wellvolution, sitting in the background with our capabilities powering a member-focused health journey across multiple conditions and point solutions, and then integrating with other non-Solera vendors to whom their members need access, really serving as the hub of their member wellness approach. And for clients that already have their health and wellness hubs that they're happy with, we can plug in, right? Being an extension to your non-clinical solution categories that you want your population to have access to. Second, clients are engaging us to be their point solution innovation hub, especially for categories with point solution growth or emerging solution categories, where the cream hasn't really risen to the top in terms of point solution efficacy. We enable dynamic curation, testing, and scaling of solutions to make sure you're ahead of the competition and best serving your population's needs. And lastly, clients engage us around specific populations or solution categories, whether it's an ASO hub or Medicare Advantage supplemental benefits hub, or specific conditions, whether a weight management solution to help triage to more cost-effective, clinically appropriate, lower intensity interventions, instead of going straight to bariatric surgery, or a way to support low to medium acuity mental health needs of members. All to say, how we configure the platform is flexible, and we've built it to be intentionally flexible. But the core capabilities and value have a common thread really across all of these use cases. So I'm going to turn it over to Byron to take you through this next section.
Great. Thanks, Brendan. I'm particularly excited. It's an exciting time at Solera as we continue our expansion of solutions beyond diabetes prevention and starting to grow and expand our suite to encompass the many facets of whole person health that we'll take a look at here in just a second. In terms of the Solera solution roadmap, some of you may know that Solera entered the market a few years ago as a diabetes prevention company, but we're really excited to share more today about our recent expansion into these other important domains of health, in particular, stress, sleep, and resilience, and tobacco cessation. But you can see that as we've grown as a company, we've moved beyond DPP into a broader suite of weight management, started to layer on services for older adults like falls prevention, social isolation, and personal care, and now are moving to expand this whole person story to address important preventive health needs like tobacco cessation and move into the mental health space with stress, sleep, and resilience. 2021 is going to bring another exciting update to our portfolio with the addition of a musculoskeletal solution, and then looking forward, important parts of addressing and building this whole person story include women's health, financial wellness, and a variety of others soon to follow. I'm particularly enthusiastic about our 2 newest solutions, stress, sleep, and resilience, and tobacco cessation, which couldn't be meeting a more pressing need. It's become clear that in the midst of COVID, smokers are particularly vulnerable, with nearly double the risk of severe COVID complications. And then likewise, stress from COVID is driving smokers to use more tobacco. About 30% of individuals who use tobacco reported that they had increased their use due to COVID. Meanwhile, stress and depression are at all-time highs. We've seen an unbelievable increase in the burden of stress and anxious symptoms and mental health. And all this is leading not only to the adverse impact in and of itself of poor mental health, but has a linkage back to smoking in the form of increased tobacco usage for those experiencing symptoms of mental health. So it couldn't be a more timely solution in the form of tobacco and mental health, where this is such a strong linkage between the two and a bidirectional relationship. This overlap between tobacco and mental health, I think, is well encapsulated by this meta-analysis, which came out a few years ago, looking at the impact on mood that occurs when someone does quit smoking. And importantly, these researchers found that when someone quits smoking, they see a reduction in anxious and depressive symptoms that is on par with that seen from taking antidepressants, with the same kind of medicines that we give in clinic to help folks manage their mental health need. So being able to quit smoking, not only do you get all the amazing benefits of quitting smoking in and of itself, but significant potential impact on mental health driven by smoking cessation. So I'll turn our attention now over to our stress, sleep, and resilience program, which is a really exciting combination of digital mindfulness and cognitive behavioral therapy programs that bring evidence-based mental health supports to employees and plan members. So we've seen that COVID has led to an explosion in mental health need. It's really quite staggering from a public health, population health, and frontline clinician experience. I've seen more patients with unmet mental health needs in these last 12 months than at any point in my career. And the data supports what we're seeing on the front lines. In one study, depression rates tripled in the months after COVID, with another showing that 70% of people were reporting that this is the most stressful time of their entire life, even more than 9/11, even more than the 2008 financial crisis. And all this is occurring in the presence of historically low access. Half of US counties have no psychiatrists, and depending on what state you live in, as many as over 2/3 of people with a mental illness may not be receiving any treatment. So it's an exploding need with already strained resources in the community that we're walking into with the situation that's been created by COVID. Even beyond the clinical diagnoses of anxiety disorders and depressive disorders, COVID has just hurt people's overall well-being. People are feeling like, in general, they're worse off than they were before COVID, and that's completely understandable given the impact that COVID's had on the economy, on our personal lives. I imagine many of us know friends or family members who've struggled with COVID or losing a job or something else. And this is being driven at its core by mental health. So in the same survey that found that 85% of employees are experiencing a decline in general well-being since the start of COVID, half of those respondents said that mental health was the greatest single cause of that reduced well-being. So not only are we seeing a rise in these clinical diagnoses, but overall a rise in the number of people who are saying, hey, this is impacting my just general well-being and outlook on life. So digital solutions, and in particular digital mental health applications, either on mobile or the web, provide a really important access point for individuals seeking mental health treatments. So with digital solutions, members and employees can get timely access to tools and services, which is really important when wait times for in-person appointments can be really long, sometimes stretching into weeks or months. Moreover, digital tools offer a different pathway with less worry about the stigma of seeking mental health and greater convenience with access through a phone or on the web. The research base in this area is continuing to grow and demonstrate that digital solutions actually compare very well with in-person therapy. And their popularity has grown tremendously during COVID. Usage is up at least 100%. We're hearing even higher from many folks in this space that we talk to, in the hundreds and hundreds of percents increase just over the last year alone. So as people are having a new need driven by COVID, but we're pushing up against the limits of access across the country. Individuals and organizations are turning to digital solutions and using them and starting to get a lot of benefit from them. But even as this area expands, there's plenty of opportunity that remains. Most employees want mental health supports online, and employers have responded. Just about over half of employers are offering a solution. But a third of employees still say that they lack these benefits. And even if a benefit is in place, actually knowing about these benefits and knowing what it means to do a digital mindfulness or digital CBT program is an area where there continues to be need for greater messaging. So it's an important time for expansion, but also a time to double down and bring these tools into the forefront and into the hands of members and employees. Offering a single solution won't meet the diverse needs of members, though. And we've seen in this landscape that there's been a huge investment in digital health more generally. 2020 was the single biggest year of investment in digital health tools in history. But as this landscape has become much more complex and much more sophisticated, it's become clear that having just a single point solution won't be able to address the diversity of needs, whether that's addressing diversity of need in terms of the specific issue a member's experiencing. Are they experiencing anxiety or depression, stress, trouble sleeping? And then their preferences, whether they want something that's a self-guided tool, a guided tool, whether they're more interested in mindfulness or a CBT approach or some combination, whether they want to use video or chat. You can start to see how all the different permutations in this space can create a lot of complexity, which is where Solera can step in and offer a very meaningful, differentiated solution in terms of our network approach to bringing these digital tools together to support mental health. So with the Solera network approach, Solera does a few things to help guide a member to their best fit solution. So first, Solera learns about a participant through their claims data, demographics, responses to a simple qualification and preference quiz. And then we use the data that we learn about the participant to determine which of the programs in our network is the best fit for that member. And by actually matching participants to a best fit program, Solera can provide a more tailored care that is intentionally directed toward the participant's needs and preferences rather than this one size fits all approach, which will work for some people, but may not work for a whole group of people that would be better served by a network. The matching also allows us to target mental health supports and wrap around physical health supports like smoking cessation towards a variety of specific user personas and to become even more refined over time as individuals use and succeed in these programs. So you can get a sense here that whether someone is at one end of the spectrum, they need a little support, they're more stressed about work than they usually were. They're feeling like they want to make a change and try and they've heard a lot about meditation. They want to bring that into their life. That person may need a very different level of support and a very different type of intervention than someone all the way at the other end of the spectrum who feels overwhelmed, may have a clinical diagnosis that is being exacerbated, may have a comorbid condition like a tobacco use disorder for which they would benefit from a second program. So Solera's solution helps not only identify these different particular personas, but craft a targeted solution in the form of a network approach to specifically address those member needs.
Thanks, Byron. So where do we go from there, right? We've established that this is a critical problem. Most of us know that this is a growing problem that really needs innovation and strong solutions put into the hands of members ASAP. So what we've done is we've thoughtfully assembled an initial network of digital point solution partners that we're confident provides coverage for the low to medium acuity mental health spectrum that is our focus. not the silver bullet for the entire kind of mental health spectrum, but really focused on that gap in care, which is that lower to medium acuity need that we're seeing the majority of the population struggle with. So, addressing anxiety, loneliness, depression, and stress allows us to support health plans and employers in covering a part of the mental health spectrum that has gone unaddressed. So we're excited to announce today our initial network of Headspace, eMindful, SilverCloud, and Element 3 Health, all of whom address the issue from a slightly different perspective, bringing important differentiators to our network approach, whether it be focus on mindfulness, resilience, cognitive behavioral therapy, or building social connections. These partners have been carefully vetted. We've looked at the evidence of their programs, their experience, capacity, and readiness to work with healthcare, their ability to support multiple languages and cultural differences, and importantly, the nuanced characteristics of their programs that we know will result in a solution that works for the entire population. So over the next few slides, we'll do a high-level overview of each partner. So I'm sure there are a few Headspace users in the audience today, so it'll be obvious to you why they make sense to be in our network. Headspace is the most adopted mindfulness tool in healthcare with over 65 million downloads. And this type of demand is for good reason, and we're excited for their partnership as they evolve from a general mindfulness and meditation tool to a really important part of this mental health care continuum. So we view Headspace as filling an important niche on the lowest end of the mental health continuum, a solution that could benefit every single person in a population, given the importance of sustained practice of mindfulness and meditation throughout life. For many folks who associate stigma with traditional mental health treatment or may not recognize that they're struggling with depression, anxiety, sleep issues, or stress, Headspace is an amazing on-ramp that will allow us to identify users who may have higher acuity needs and nudge them to appropriate solutions while still benefiting from the Headspace experience. And their outcomes speak for themselves. They've shown that they're able to decrease depressive symptoms by up to 46% in just 8 weeks. They decrease stress by 32% in just a month, and happiness by 14% after just 4 sessions. And they've shown their ability to decrease anxiety by 31% in 2 months. This is backed by over 26 published papers, and they're the types of outcomes that can drive meaningful improvements in health outcomes, productivity gains, and cost savings, while helping people be happier and more resilient. Our next solution, eMindful, provides us with a solution on that next rung of the mental health continuum, really focused on applied mindfulness, or said another way, using tried and true, but also innovative mindfulness techniques, but making sure that they're applicable to the issues and concerns faced by your members in real time. By focusing on relevant information and supports offered on demand and in live sessions, they help people make mindfulness real, whether that's tackling their smoking addiction, whether that's recovering from cancer, chronic pain, or financial stress. A number of different modules that they have in place that can be applied with mindfulness techniques to help people cope and build resilience to deal with those stressors. So, importantly, this solution, like others in our network, serve to augment rather than replace other point solutions you may have. For a member engaged with, a health coach to support weight loss, eMindful can help equip that member with a more expansive toolkit of tactics to help them on their personal health journey by learning to better manage cravings and positive reinforcement. It serves as an outcomes booster to the outcomes of so many clinical and non-clinical programs that you may have in place today. Backed by multiple validated studies over more than a decade of work and research, their outcomes are really strong. 65% of users engage on average twice a week. 54% of users improve their sleep. 55% have reversed metabolic syndrome. And they see upwards of 45 minutes of productivity gained per week. So really excited to have them in our network as well. SilverCloud provides internet cognitive behavioral therapy to expand access to the millions of Americans that could benefit from the evidence-based CBT intervention, but bringing it to their fingertips through a digital solution. So for members with mild to moderate anxiety, stress, depression, and other related issues, and who could benefit from intensive coached programs, SilverCloud is our recommended solution. And just as with Headspace and eMindful, they serve as an on-ramp and an off-ramp to lower or higher acuity solutions depending on need. So if a member meets their anxiety reduction goal with their health coach through SilverCloud and may no longer need that level of intensive coach solution, they can be triaged back to Headspace as an example to provide a lower intensity solution that will help them manage anxiety over time. Likewise, if they identify that there's a member with a score higher than 15 on the PHQ-9, indicating severe depression, they can be triaged to more intensive telepsychiatry or work with the psychologist while remaining in SilverCloud to help them in the meantime. Their solution, like our others, evidence-based, based on nearly 2 decades of research, and they've served over 550,000 users, 7 million clinical interactions, all of which has shown a really strong net promoter score of 93, 65% experienced significant clinical improvement, greater than a 3-point improvement in mood score, which is correlated with a lot of positive health outcomes. And 56% no longer have a diagnosis of depression or anxiety after 3 months of use. And lastly, Element 3 Health addresses the loneliness and isolation epidemic we're facing, which has been exacerbated by COVID. They offer in-person and digital clubs and activities for all ages with the goal of improving social, mental, and physical health. They're often offered as a different approach than silver sneakers for Medicare plans for the 90% of populations who don't utilize gym passes. And they have a nationwide network of clubs and activities providing groups for everything from knitting to gardening to hiking to pickleball. But more importantly than the type of solution they offer, the common thread is that they connect people to peers and activities that spark joy and provide meaning. We don't think of this at Solera as a nice to have benefit enhancement. What we know about loneliness and isolation is that we're at epidemic levels in many developed nations, with an emerging evidence base linking that isolation to negative health outcomes, increased mortality, and poorer quality of life. If you're socially isolated, it's more harmful than 15 cigarettes per day. You have a 64% increased chance of Alzheimer's or dementia. You have a 2 to 5x increase in premature mortality and a 4x increase in hospital readmission within 1 year of discharge. Community is important. Social networks are important. And too often we're feeling isolated, especially over the past year. So through Element 3 Health, their digital and in-person clubs and activities, 89% of people have made new friends, 76% feel healthier and more alive. And a couple of things really stuck out to me as I learned more about the solution. For those who regularly play board games, right? Something that we think of as just another fun thing to do, a 74% decreased risk of dementia. Playing tennis regularly is tied to almost 10 years in increased life expectancy compared to a sedentary individual. So for members who are struggling with isolation and loneliness, our platform will help triage to this solution. So as we spoke to the market and understanding what would be most helpful in a mental health solution, the obvious feedback was choice, right? There's not a one-size-fits-all solution. But what was just as critical was recognizing the big gap that they had to fill on that lower to medium acuity spectrum. Most had nothing in place, and some felt that what they had wasn't really sufficient or was hidden within kind of a larger EAP or suffering from bad engagement. So as we teased this issue out, we determined that filling this gap with the types of point solutions we just went over would be a huge value add, but not sufficient in and of itself, because without a thoughtful approach to integration, they'd still be on their own little island, right? Siloed and disconnected from the existing mental health tools and supports that you may already offer to members. So it's why we've intentionally designed our platform and this network to be configurable, to integrate with everything from EAPs to care management software to EHRs. So we're making sure that the solution is designed in a way to enable triaging to the right level of care, whether that's through a Solera partner or not. And to support closed-loop data sharing for your authenticated care teams to have secure access to important activity, engagement, and outcomes data across multiple point solutions that they may otherwise would not have for this user base. So this intel is super valuable in that it can provide early detection to potentially more significant mental health issues, allowing you to intervene before too late. So let's walk through a quick example of what this looks like. At the initial member engagement, a member profile is developed. They're initially identified as someone not getting enough sleep and feeling a little stressed. So they're enrolled in mindfulness. Based on their initial member profile, they enroll in Headspace as an example. And that member is using the mindfulness app daily, reading content on social isolation, and meditating 3 times a week, doing a good job engaging, making good progress. So we learned that the member throughout this activity may need more help and updates their profile to reflect that they may be stressed and overwhelmed. So we would contact the member to suggest moving into another program that may better meet their growing needs. We then enroll them in a CBT program with a health coach to help them build resilience and deal with financial stress. And all of this over time results in a reduction in their perceived stress score. So good overview of our new stress, sleep, and resilience program. Really excited to be able to offer this in a turnkey way on Solera Connect platform. And I'm sure there are some questions, but I'm going to turn it over to Byron to introduce our tobacco cessation program.
Thanks, Brendan. That was a great overview of the new exciting work coming out of the organization in mental health. And I'm really delighted and proud of Solera's innovative work in addressing one of our nation's and the world's longest running public health crises, that of smoking and tobacco use. The reality is that smoking remains the single leading cause of preventable death and harm in the United States every year. Even something as simple as smoking, which has been around for hundreds of years, and we have a century of data showing the negative health impact of smoking on the health of individuals and their communities. You know, smokers lose over a decade of life expectancy compared to non-smokers. And not only does smoking lead to loss of life, but millions of individuals live with smoking-related diseases that can be debilitating. And all of these downstream health effects of smoking drive significant medical spend, as much as $2,000 a year per smoker in some estimates. And smokers struggle more than their non-smoking employees at work, missing 2 to 3 more days of work each year and incurring thousands of dollars in lost productivity. So there's a strong societal and organizational and individual imperative to help people quit smoking and help them quit other tobacco products. Right now, COVID has created a convergence of trends in smoking cessation that make it an important time to help tobacco users get quit from their nicotine addiction. So we saw that as stress about COVID increased the stress of individuals, smokers increasingly turned to cigarettes and increased their consumption of combustible tobacco. This is occurring alongside something that's been bubbling up to the surface for a few years now, which is the vaping epidemic among teenagers and young adults. Since 2017, we've seen almost a tripling of vaping use among teens, to the point that now you can see 27.5% of teens were vaping in 2019. Just an astounding number, and putting those individuals at risk for long-term nicotine addiction and potentially conversion into not just users of e-cigarettes, but users of combustible and other forms of tobacco. Even with decades and decades of public health impact, still about 20% of the US population are using some kind of tobacco. But most smokers try to quit. Most smokers want to quit, but remain unsuccessful. We've used the same suite of tools for a long time, but this new suite of digital tobacco cessation tools is something that many smokers haven't tried, but that they're interested in. About half of smokers are interested in using a digital program to try and quit. The other piece that can make tobacco cessation particularly difficult is that it takes a lot of attempts to quit before success. At least 6 attempts using some conservative methods, but others will put that number in 30 plus attempts, even some as high as 100 if you really count even like people just thinking about quitting as a cessation attempt. So it takes folks a lot of attempts to quit. So getting things into the hands of smokers and tobacco users that encourages them to quit and that makes them want to quit more often and increases their likelihood of succeeding on any given quit is paramount in getting tobacco use rates under control. So there's a ton of quit activity going on each year among employees and health plan members. About 60% of smokers are trying to quit each year. But most of those folks are still quitting unassisted, which carries with it a 95% failure rate. So smokers, despite wanting to quit and trying really hard to quit every single year, are still not getting the supports that they need to increase their chance of success. Now, only about a quarter of people who try and quit use NRT, even though it doubles your odds of quitting essentially. And then in terms of tools like the quit line that we've all heard of, these are tools that smokers generally, even though they know about them, don't find to be meeting their needs. Only about 8% of smokers will try and quit using a quit line, even when they're actively trying to quit. So the rise of digital tobacco tools offers a new pathway, a new form of support that many people who use tobacco have not tried in the past. But these programs have not been broadly messaged, even though they're quite effective. And even though 12 million adults search online every year for help quitting. So folks are asking for help. They're asking for resources. The current resources that are being used haven't been as widely adopted. And there's a big opportunity to put these digital programs in the hands of people who really want to use them so that they can get quit for good.
Thanks, Byron. When I talk to the market, here's what I hear, whether it's payers or employers. They have a solution. They've had it for a couple of decades. People don't use it and it doesn't work. And they've accepted that, largely because they're unaware that there's exciting innovation in the space that's actually happening. And I think over time, we've seen some great trends in public health in terms of quitting over the past half decade, but that have largely plateaued and in some cases have reversed in the last half decade due to vaping. There is still a massive unmet need to provide better, more engaging, more personalized solutions to members. But this isn't what they're hearing from their members or from their large strategic accounts when they're thinking about what's next from a point solution category standpoint, right? They're talking about MSK, they're talking about women's health, of digestive health. Well, here's what we know. This is, to Byron's point, still one of the largest drivers of poor health outcomes and costs that you will see in a population. An incredibly antiquated solution likely available to members today with innovation ready to go. So a real opportunity to bring innovation to your members, to bring innovation to your strategic accounts, to combat the what we view as a wrong assumption that there's nothing else that you can do. So really excited to announce our network of solutions making a difference in this space. We've intentionally designed this network that can provide a different approach to your existing 1-800-QUIT line for the 90% of your smokers who want to quit that will never use those solutions. And we wanted to make sure that as we built this network, we had coverage for multiple tobacco uses, from combustible cigarettes to smokeless tobacco to vaping. And we wanted to make sure that they were offered in a convenient way to lower the barrier to entry and sustained engagement as much as possible. So the network we've assembled comprises Click Therapeutics, Clickateen, Truth Initiatives X program, and eMindful's Quit Smart Mindfully programs. And as with all of our networks, there are critical differentiators between solutions, but also commonality in their use of technology, best available evidence to guide their intervention, and intensive supports and peer supports to help members on their journey to quit and stay quit. All these providers that we've pulled together also offer nicotine replacement therapy, really critical to increase the likelihood of quitting for a large number of people. And we've structured this program in a way that doesn't contribute to further stigmatize smoking, but rather celebrate quit attempts. Recognizing that it takes on average over 6 quit attempts to finally overcome this addiction, helping people stay committed, celebrating the small wins goes a long way to supporting their needs. So we'll walk through, again, at a high level, each of these few solutions that we pulled together. Our first provider, Clicatine, offers a personalized mobile experience driven by artificial intelligence, but based on evidence on US Public Health Service guidelines. They focus on overcoming cravings, really highlight frequent mobile-based nudges, personalized nudges, and social engagement with peers, family, and fellow quitters to provide the support they need to stay quit. And like all of our providers in this bundle, their outcomes are incredible. From an engagement metric standpoint, showing 100 plus app opens over the first 2 months of usage on average over 2 times a day. We're thinking about that in comparison to the status quo interventions of 1-800-QUIT lines, expecting members to pick up the phone when they have an urge to quit, to call somebody, to talk to a different human, is simply not sustainable or realistic for a large part of the population. So having that in your pocket tool to help you whenever you're ready to quit or to prepare you to get ready to quit is really critical to their success. And we see that in a 35% quit rate at 6 months. Our next solution, Truth Initiative, we all recognize the brand. We've all seen their commercials. They've been one of the largest drivers and champions of smoking cessation over the past couple of decades and have evolved to become a leading researcher, the largest cessation support community in the world, and providing evidence-based personalized tobacco cessation programs. They've developed this with the Mayo Clinic, their X program, and it's been validated with over 60 peer-reviewed studies. It's as evidence-based as it comes. And we've seen the result of this in supporting over 910,000 X program users to date, a 34% quit rate at 9 months through on-demand personalized text messages and tailored support for both cigarette, e-cigarette, and vape users. And eMindful, who we've already talked a little bit, they're kind of our overlap between tobacco and mental health, but we'll talk a little bit about their Quit Smart Mindfully program. Based on Duke University research, this is our most structured course out of the 3 for a certain type of learner. 12 courses with a set quit date at the end. The solution helps people prepare for their quit and then achieve it. And they've shown a 40% quit rate at 6 months through this method. But once complete, after the intensive structured course, they'll still have access to on-demand content and peers and community to help them stay quit. And they do this again through applied mindfulness training. And one of the important differentiators here is the ability to integrate with other training modules like financial stress, chronic health conditions that impact people's physical and mental health. So between all these providers, they've demonstrated significantly improved quit rates over what you've come to believe is achievable with the status quo behavioral interventions that we largely still see out there in the market today. Baseline quit success for folks who don't have support is about 5%. With a traditional behavioral intervention, that's your 1-800-QUIT line or something similar, roughly doubles that quit rate up to 10%. These programs that we've assembled in our network increase that anywhere between 34 to 40% quit rates at 6 to 9 months. Really significant jump in their ability to help people quit and stay quit. And they've accomplished this through offering multiple formats, personalization, artificial intelligence, and innovation to drive member engagement, nicotine replacement therapy, importantly, and really supporting all different forms of tobacco usage and vaping. So really excited to offer this network. Again, not the type of thing that you may be hearing, oh, this is exactly the next solution gap that we need to fill from a point solution standpoint, but talk about low-hanging fruit to impact health outcomes and impact costs. So with that, we are going to open it up for some Q&A. We have just about 10 minutes left. I'm going to come back on video, and you can either use the Q&A function or I believe we can take you off mute if you raise your hand to ask your question live. Happy to take any additional questions that there may be. We got a nervous audience today. I know there have to be a few questions.
Brendan, can you hear me now?
I can. Hi, Joanne.
How are you?
Great, thank you.
Do you have an observation in terms of the COVID experience, in terms of how employers have responded or reacted in terms of their carve-out programs? You know, specifically, I used to work for a carrier, so concern about the commercial market losing revenue due to the impact of COVID. And do you see them still holding on to programs that are important to well-being, or has there been some reduction in that commercial space?
Yeah, great question. I'll take a stab at that and welcome any colleagues of mine to jump in. But last year was strange, right? So there was at the beginning of the year, as premiums were set and premiums collected, no understanding that COVID was on the horizon, and then it hit us and resulted in a lot of people holding off on care that they either didn't need or were kind of afraid or not kind of willing to go into the doctor office to receive. So a lot of elective surgeries and other procedures that folks weren't getting that the carriers had banked on, right? So in fact, last year, we saw a lot of energy and excitement towards the end of the year, largely due to kind of making sure their medical loss ratio calculations were kind of hitting that 85% target of driving excess capital into wellness and health programs to serve their members, given that they weren't receiving the volume of their kind of traditional claims that they had come to expect and had budgeted for. So that was an interesting dynamic to 2020 that we'll see carry over into 2021 as well. But I think also there's, COVID resulted in many changes, some of which we haven't even recognized yet, but largely a recognition that we need to change how we engage members and how we provide them access to solutions. So providing members with simple to engage, simple to access platforms and point solutions that can manage their conditions from a low to medium acuity standpoint is increasingly becoming seen as critical and table stakes. So I think we're excited about what we're seeing in the market, and I think we'll continue to see this year increased investment, not just in the solutions we talked about today, but platforms to make it easier for employees and members to engage in these, and additional point solutions covering preventive chronic conditions that payers believe they can have an impact on.
Thank you.
Welcome. So a few additional questions that have come in through the Q&A. One being, are these programs applicable to Medicaid populations? These programs we view as being applicable to all populations, right? Regardless of age, regardless of line of business, whether you're talking about your 65 plus predominantly Medicare population or your lower income Medicaid population, or your commercial population. What we know is everybody's dealing with low to medium acuity stress, anxiety, and depressive symptoms. And likewise, there's tobacco use across all of those different lines of business. Higher, yes, especially in Medicaid. So particularly relevant in Medicaid for the tobacco solution as well. An anonymous attendee asked, are there any language interpreters access? So at Solera, we have a fully staffed call center that does support, I believe, only Spanish at the time, but we do have an interpretation service that allows us to interpret in, I think, upwards of 100 plus different languages. All of our different providers that we pull in network are going to look a little bit different. Some offer their services worldwide and offer different 15, 20 different languages. Others still may only have English. We try to develop enough of a network approach to make sure that we have at least kind of the core languages that we need to make sure we have covered, like Spanish, covered within a particular category. Another anonymous question that just came in. We have several Medi-Cal colleagues on the line today, so just wanted us to verbalize a confirming message. Thank you. How long does it take to get a program launched with Solera? Great question. So we try to develop all of this in as turnkey a way as possible, right? From the time that we kind of align around which solutions that you want to offer and when we can go live, we're generally talking about 2 to 4 months, depending on the level of scope and required integrations. But right now is a great time to be planning for your 7/1 plan renewals, an even better time to be planning for your kind of 2022 benefits package for the Medicare leaders on the line today. But we offer this in a very simple way for providers to get up and running, branded platform, white labeled platform with some simple integrations. We generally look for eligibility data, some claims data, member contact information, and then are kind of setting up a semi-configurable platform to allow access to as few as one or as many as all of Solera's different categories. Another question that just came in general, how does Solera's network curation function help a payer where contracting is concerned? Great question. Yeah, so this is one of our core value propositions. What we still largely see in the market is payers and employers who are overwhelmed by the number of amazing innovations that they want to test, that they want to offer to their employees, but they simply don't have the bandwidth to stay on top of what's working in the market, what's innovative out there. And then going through the traditional kind of procurement cycles, implementation, working out the kinks, and getting it to scale. That could take a few years, realistically, for a buyer to implement a new point solution. So the nature of our model allows us to really streamline and reduce the amount of time it takes to stand up new solution categories, to swap in and out point solutions based upon need, based upon changing preferences, and the achievement of outcomes in our network. That allow us to really reduce the amount of time it takes to stand up these solutions, but then the efficiencies that we drive to manage these solutions long-term results in huge cost savings and resource efficiencies. Well, thanks all for the great questions today. We are right at about time. Can't believe we actually did that on time, Byron. Cheers. I know a lot that we threw at you today, so we'll be sending around this recording of the webinar to all the registrants afterwards. And I think everybody will have, if you're still on, you can see my contact details. Please feel free to reach out, ask any follow-up questions. We'd love to talk to you about how Solera can potentially support your needs in these areas. I want to thank everybody for joining today and taking the time to learn about our platform and our new solutions. And we'll look forward to hearing from you. Thank you, everybody.
Thank you.